Hi everybody, my name is Narissa. I'm going to be talking to you guys about my poster on Bedside Shift Report and how I came across this PICO question. So to begin, I wanted to research on something that I could utilize as a nurse when I become one. And I know my report is not the best, so I researched on what is the best way, and that's how I came across Bedside Shift Report. So my PICO question is, does bedside shift report compared to traditional report improves patient satisfaction in patients admitted to acute care facility? So the main purpose of implementing bedside shift report is to decrease errors between communications of medication, like verbal orders or treatment. This allows the patient to feel more involved in their care because now they can hear what is being said about them, and if the nurse has a question, they're already at bedside, so they can ask the patient any like clarification or anything. So how I came across my research was I used a couple electronic databases such as CINAHL, PubMed, and EBSCOhost. Some of the keywords that I used in finding these articles was bedside shift report, patient satisfaction, nursing shift report, and traditional shift report. So what I included in my search to narrow it down was making sure it's research studies, it's peer reviewed, it's from the US, it is between the time frame of 2012 and 2020, and it's of English language. So this limited my searches, and so I wasn't able to find anything that was, before 2012, was outside of the US and was not of English language. So based off of my research, my long hours of research, I found 6 strong articles, and of the 6, I utilized 3 based off of their strength and quality to answer my specific PICO question. So for the first article, it was my synthesis of evidence table. It was by an author named Falloon et al., and the purpose was to evaluate the effectiveness of multi-method education intervention and its effects on nurse compliance on bedside shift report. So the result of this study revealed that there was overall compliance and improvement in nurse communication and improvement and increase in patient satisfaction, which answered my PICO question. So the next study was by Sandy and Sherman, and these researchers' purpose was to quantify quantitative outcomes of practice change to a blended form of bedside shift report, bedside nursing report, and the results of this article showed that the patients were satisfied by the use of bedside shift report, knowing that they were able to be more involved in their care and provide any necessary feedback to the nurses. So the last study used in my table was by Wakefield et al., and his purpose was to see if implementing bedside shift report improves patient satisfaction. And the results of this study was run over 6 months and showed significant increase in patient satisfaction. So all 3 of these articles were very strong articles that answered my PICO question. So now to move over to the recommendations. The first recommendation was to implement the report over multiple different units, because for most of these studies they were used on like an inpatient stroke unit, and they were limited to certain like particular units. And this showed some challenge because nurses that would float to the only the unit that used bedside shift report was hard, because then they would go back to their traditional report at different units. So another recommendation would be to implement this over a longer period of time, because for the last article by Wakefield, it was only over 6 months. So this is long, but it's not long enough to really see the effects of implementing this, because patients come and go. So you would really want to do it over a longer period of time. And the last recommendation is to provide an educational course on how to effectively utilize this, because some nurses was using different methods of it. So really teaching the nurses the correct way of how to do it. Bedside shift report, or well, not the correct, the most effective way to do it to benefit both the patient and the nurse. So to conclude, bedside shift report showed a significant improvement in the quality of care and patient satisfaction. This overall allows the patient to be more involved in the care, and overall it kind of holds the nurse more accountable, because now they know that the patient hears everything that is being said. So going back, they can't say, oh, I didn't know that. So now they are held more accountable, and this can overall lessen the chance of communication errors amongst healthcare workers. So this is it for my presentation. I hope you guys enjoyed listening. I'll be waiting for your feedback, and I hope you have a good day.